research programs for the American Board of Pediatrics and the American Board of Pediatrics Foundation. She maintains her position as Professor of Medicine and Pediatrics at Tufts University School of Medicine. She has extensive research experience in the areas of identifying, treating, and delivering health services to children and adolescents with medical, developmental, and mental health needs. Dr. Leslie also has worked with a number of pediatric initiatives to improve the future of physician training and practice with the ultimate goal of improving outcomes for children and adolescents. Dr. Leslie is board certified in general pediatrics and developmental behavioral pediatrics.
To have the opportunity to be the last speaker between you and the bathroom, emails, or talking to people in the audience, or some of the speakers. I'm going to keep my remarks relatively short, and I want you to know that I'm here speaking on behalf of the American Board of Pediatrics. I wanted to start with just sharing what the American Board of Pediatrics is and how does it differ from the American Academy of Pediatrics. We are one of 24 medical boards that certify physicians in the U.S. What that means is we say pediatricians have meet certain standards of excellence with respect to the training that they've had, both as a generalist pediatrician or as a subspecialist, and that they're maintaining their certification, that they're committed to lifelong learning and practice improvement about how they're doing things and staying up to date with what's current. We have over 250 practicing pediatricians that serve on our committees and help us to set those standards. We are not a membership organization. Again, our purpose is to assure the public that pediatricians are meeting standards of excellence. Because of our role in standard setting and certification, we have to make sure that what we are setting as standards align with what the needs of children, adolescents, and families are. And we have decided that mental health has got to be one of the priorities of the pediatric community and that we need to do what we can as a board to address this issue. The numbers you heard today that are staggering have been remarkable for us to consider as a board as well. I just want to highlight a couple of those. 1 in 2 Americans will have a mental health problem. 75% of those problems start before they hit young adulthood. If we don't do things in childhood, we're going to run into the problems in adulthood, and we're already seeing that. 1 in 6 U.S. parents say their 2- to 3-year-old has been diagnosed with a behavioral, mental, or developmental problem. That is staggering. 4 in 10 youths, ages 13 to 17, have experienced a behavioral problem by the time they reach 7th grade. 1 in 13 high school students attempt suicide. With numbers like this, we have to respond as a community and as a country. Now, not only are these numbers staggering, but I wanted to share with you a couple of stories when I emailed some of the parents and pediatricians that serve on the committees with the ABP. Here's one story. A young, well-educated mother moves from one state, Tennessee, to Vermont. She's in her 38th week of pregnancy. She has a husband that works and a 4-year-old. She's isolated and alone after she delivers. She's overwhelmed. She's sleep-deprived. She goes in to see her primary care provider. An appointment is set, but it's a far way off in terms of her own needs. She hangs herself, and the 4-year-old finds her. This is a true story. How might these outcomes have been different if her primary care doctor had co-located and integrated mental health services and had been able to refer her to a program that normalized the stresses that new parents face? A second story. A 3-year-old son, much like what we were hearing from Rebecca, who's bright and rambunctious, but has been suspended from preschool 3 times. Both parents work. There's increasing stresses on their marriage, stresses on them financially, as one person is continually having to take time off for each suspension. How might these outcomes have been different if their primary doctor had co-located, integrated mental health services available, and was able to refer them to a parenting support program that provided routine, evidence-based behavioral modification approaches with role-playing and provided guidance on how to work with their school? A third story. A teenage girl growing up seeing her single mother physically and sexually abused. She's scared and worried. She develops a tough persona. She's kicked out of school for truancy, and she's pregnant at age 15. She's worried about how her own child doesn't implement this same type of cycle. What kind of outcomes might have been different if her primary care provider had access to co-located, integrated mental health services and could help her integrate and participate in a parenting program that targeted pregnant teens so this cycle didn't continue and she could break the cycle. A fourth story, a 4-year-old girl who's in foster care with parents who keep a very tight, regimented schedule, and she's successful in it. She's adopted in a community that's very far away from where this family lives, into a loose, wonderful family, but where life is not structured and routine. She acts out, she breaks a window, she breaks a television. This is a true story. The family decides she's too much. She's back with now a 3rd foster care family. How much more would things have been different if this primary care provider for this young girl had been able to have co-located integrated mental health services and been able to help this family access evidence-based programs for parents who are adopting or serving as foster parents for children who've been experiencing trauma. Pediatricians are in a unique position, and you've heard a number of the barriers today for what we can do. As an American Board of Pediatrics, we are saying that we're going to set higher standards of excellence around mental health needs. We're also partnering with the greater pediatric community to say what we can do as a group. The American Board of Pediatrics, the American Academy of Pediatrics, and 7 other organizations are meeting this coming weekend to say how do we change pediatric residency training so we can really address mental health. But we have to move this outside of the pediatric community. Last week here in Washington, D.C., the World Health Organization and the World Health Bank held a meeting on global mental health, and they pointed out for every dollar spent on adult mental health, you could recoup $3 to $5 of economic contributions in years of healthy life. This is talking about internationally. We have to focus here on our country, and we have to think preventively about the children. We joined the AAP in recommending more support for parenting skills interventions, more support for research, and I want to also echo what Dr. Dreyer said. It's so critical that we look at implementation. We have families living in rural areas and urban areas. We have families that have no risk. We have families that have mental health risks or social emotional risks. But we also have families who have children that are diagnosed with chronic disorders that are also facing challenges as they try to navigate providing for that child and maintaining a marriage and supporting their other children. I want to close with a quote from one of the mothers who serves on one of our committees and provides peer support to other parents whose children are born with major heart defects. She wrote, "I'd love to see our healthcare system create national mental health standards, promoting and supporting processes enabling clinicians, teachers, therapists, and peer-to-peer leaders to work collaboratively, uplifting at-risk patients and families. The key to all of this is communication and in affording professionals the time throughout busy days to focus on mental health care. We cannot afford to put the mental health of our children and families in the back seat anymore. We're in need of significant change. Not today, but yesterday. We urge all of you and Congress to work with us in the pediatric community to support healthy parenting and primary care. And we thank you for your commitment and action. Thank you.